Johnson for 5 minutes.
Thank you, Mr. Chairman, and good morning to our panelists. Thank y'all for being here with us. Today's topic is one that really hits home to me. As an IT professional and a patent holder myself, I know the pains that individual Americans and companies go through each day to try and bring their ideas to market. I mean, you think about what has grown the most powerful economy on the planet. Where does innovation, how does ingenuity fit with innovation in the American free enterprise system? Ingenuity rests along that highway between innovation and investment. And for someone to have a great idea and to have the mindset to pursue great ideas, ingenuity, they gotta have some certainty that there's gonna be some payoff, some reward for their work. And when innovation pulls investment, you know, I think back, for example, to the invention of the airplane and the light bulb. Nobody asked for any federal government help, subsidies, incentives, any of that stuff. These were people that put their own money, their own reputation, their own time and energy on the line to make something happen, because we had a free enterprise market that promised that if they were successful, then investment dollars are going to follow. But when investment pulls innovation, rather than innovation pulling investment, when it's the opposite direction, when the federal government, through either regulations or laws, begin to influence what is invested in innovation begins to die. And as a result, because of that uncertainty, so does ingenuity. We need to provide businesses with the certainty that once a product is tested and proven safe, there's a reasonable process for getting it to market. In recent years, numerous software products that treat serious diseases have received FDA clearance and approval. These products, prescription digital therapeutics, or PDTs, put world-class care at patients' fingertips for afflictions ranging from opioid and substance use disorder to PTSD, ADHD, stroke, eye conditions, and more. While drugs and other products that complete FDA review are then reviewed by CMS for coverage determinations, PDTs do not fit in CMS's existing benefit categories, and the agency's been unable to consider them for reimbursement, thus jeopardizing the ability of patients to receive access to cutting-edge, life-saving treatment. So, Dr. Aglag, American innovation has saved and improved the lives of millions of people, domestically and around the world. Would you agree that in order for companies like yours to continue into the future, we must have a path to reimbursement for products completing the FDA review?
Thank you, Congressman, and I'm sure you're not surprised the answer is an absolute yes. And thank you for highlighting the importance of individual innovators and entrepreneurs and how that ecosystem works, because it does require a level of predictability to get an investment, and it requires knowing what's at the end of the process. The process, as I said, might fail, but if you succeed, you need to know that you have the ability to get your products to benefit patients.
Okay. Well, I was pleased to see that CMS included a request for comments on digital therapeutics in the proposed calendar year 2024 Medicare physician fee schedule, including requests for comments on how digital therapeutics could be covered under existing coverage pathways. Dr. Miller, in your opinion, how could CMS use existing benefit pathways for digital therapeutics, which are already being used to pay for, quote, unquote, software as a medical device, to reimburse for those innovative and effective tools?
Excellent question. A couple answers. One is the chronic care condition management codes. CMS could use those to reimburse for software. I think the other thing we need to think about is should software be allowed to compete within the Medicare program? Right? There are some things that we do not need human capital to. We don't have enough doctors. We don't have enough nurses. We don't have enough licensed nurse practitioners. We just don't have enough human capital, and we can't fund enough human capital. So is there a way that we can allow technology into the Medicare fee-for-service program to augment human capital?
Okay. Well, thank you. With that, Mr. Chairman, I yield back.
Gentleman,